I want you to look at the way this sister, who was in labor, was treated at Dallas Regional Medical Center, and then we'll talk about it further.
When's your due date?
Right now.
Is your due date 11?
What?
How many times have you been pregnant?
3.
This is your third pregnancy? You
Yes.
have 2 babies
It's
at
in
home?
my.
2 babies at home? Who's your doctor?
Lang is her doctor.
Hey guys, I'm here with Mom and Baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He said have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and the fluids was green, and like I said, he born with his eyes open. So they are, taking all that in consideration as well. But he's eating well, sleeping well, looking good. Thank you again for your support and your concerns, and we will most definitely keep you updated.
Do you see the way that this nurse was so lackadaisy and just like, asking her questions that she didn't really need to ask? She didn't really need to ask while this woman was in distress, in pain, in labor, clearly in labor, okay? She should have been put on a bed. She should have been wheeled into a room. She should have had a doctor ready to deliver. She should have had all of that stuff. I don't even see, like what's normal, the process. When you go to triage, they check your blood pressure. They check, none of that is going on. This woman is sitting in front of the computer asking, is this your second, how many children? Like, what? Meanwhile, this woman looks like she is ready to drop. And then when she said that it was in her behind, that suggests that, listen, this baby's coming. And apparently, she delivered that baby 12 minutes later while she was going through all of that. And as you can hear in the rest of the video, I guess her friend or whoever is with her is saying that the baby ended up having a bowel movement inside of the mom, and then also was born with the eyes open. So there's a lot of tests that need to be done. We need to make sure the baby's okay. All that could have been avoided if this sister was treated the way she is supposed to be treated, as a Black woman in labor. But this is exactly why in the United States, the mortality rate of Black women who give birth, live births that is 2.5 times higher than the folks, or any other race for that matter. It's because of this. It's because of the lack of concern or care for a Black woman who is giving birth. The ridiculous myth, or whatever that nonsense talking point is, that Black women can take pain and Black people have thick skin and all this other nonsense. And quite frankly, just the systemic racism that exists in these institutions and the clear lack of care for the Black life. And that's it. The Black life of the woman, the Black life of the baby. No care whatsoever. And that's what it boils down to. This nurse has no business working. She should not be a nurse. She should not be working at that medical center. She should be let go. And this sister Man, I'm talking huge lawsuit. Huge, 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 huge. So I'm going to follow this story because I'm really curious to see how this ends. But this really infuriated me big time. So two things need to happen. That person needs to lose her job. There needs to be a lawsuit, especially if something's wrong with that baby. Lawyer up, sis. Lawyer up. Please. And let's get something going here. So I really am going to keep an eye on this one because I'm curious to know how this ends. But family, let me know what you think about this. Drop your comments in the chat. Don't forget to like, subscribe, share this content. Also, don't forget to download the African Diaspora News Channel app from your Google or Apple store. And don't forget to subscribe to my YouTube channel, Ansah Unfiltered. Until next time, please be safe.